Hi everyone, my treatment topic for the Share What You Know assignment is eye movement desensitization and reprocessing, also known as EMDR. The population I chose to research is military individuals with PTSD. So just a little overview of PTSD. It's post-traumatic stress disorder, most commonly known as PTSD, like I mentioned. It's a disorder that can occur following the experience or witnessing of life-threatening events. These can include military combat, natural disasters, terrorist incidents, serious accidents, or physical or sexual assault in childhood or adulthood. The population that I chose for this specific project was individuals in the military. People who suffer from PTSD often relive the experiences they had. This is mostly done through nightmares and flashbacks. They can also have difficulty sleeping, and they can feel detached or estranged. These symptoms can be severe enough and last long enough to significantly impair the person's daily life. People with PTSD experiences 3 different kinds of symptoms. The first set of symptoms involves reliving the trauma in some way, such as becoming upset when confronted with traumatic reminder or thinking about the trauma when you are trying to do something else. The second set of symptoms involves either staying away from places or people that remind you of the trauma, isolating from other people, or feeling numb. And the third set of symptoms includes things such as feeling on guard, irritable, or being easily startled. Unfortunately, many people do not know they have PTSD or do not seek treatment, and about 30% of men and women who have spent time in war zones experience PTSD. So what is EMDR? EMDR stands for Eye Movement Desensitization and Reprocessing. It is a type of therapy used to reduce trauma-related stress, anxiety, and depression symptoms associated with PTSD, and to improve overall mental health functioning. During EMDR, the therapist guides the client through a 30-second dual stimulation. These exercises include using bilateral eye movements, tones, or taps, while the client focuses on the target disturbing experience and then on any related negative thoughts, associations, and body sensations. EMDR sessions can range from 3 to 6 sessions, or even up to 12 or more sessions, depending on the person's experience, and individual treatment sessions are recommended to last anywhere from 50 to 90 minutes. There are 8 phases of EMDR treatment, as you can see here, that's used to treat individuals in the military suffering from PTSD. In the first phase, the assessment of the client's stressful experience takes place. The symptoms and thoughts of the patient wants to get rid of are often discussed, and goals of the treatment are set. In the second phase, the therapist makes sure that the patient is in a relatively stable phase before talking about the threatening experiences. The client may want to learn special relaxation techniques if he or she does not seem stable enough to once again go through the threatening events mentally. In phases 3 to 6, images, beliefs, emotions, and body sensations that are related to the threatening event are identified and discussed. After identifying these items, the client focuses on them while following the therapist's finger that is moving back and forth. It is repeated until the patient does not feel distress anymore while thinking of the formerly bad memories. The client is then instructed to think of a positive belief that the therapist and the patient have agreed on before. Afterwards, in phase 7, the client is asked to write down anything that is referred to the stressful event and may occur in the time after the last treatment session. And then lastly, in phase 8, which is usually conducted in the next treatment session, changes to the client situations are evaluated. The effectiveness of EMDR is that it's been shown to successfully treat individuals with several presenting traumas, especially individuals in the military who no longer experience flashbacks, nightmares, or other post-traumatic stress disorders. EMDR is also a safe therapy and has no negative side effects. One thing that I found doing some research was in the Journal of Traumatic Stress, dated 1998. It was an article clearly stated the effectiveness of EMDR for the treatment of PTSD. It stated that 60 traumatized military individuals were treated with the use of EMDR. It is also effective because it includes a wide range of self-help techniques. These techniques allows people to manage stress, change their emotions, and help get rid of negative images, just to name a few. A recent study of individuals who experienced military combat found that 84 to 90% had relief of their emotional distress after only 3 EMDR sessions. Another study showed that EMDR was twice as effective in half the amount of time of standard traditional psychotherapeutic care. And then if you take a look at the two pictures I provided, it gives you a good visual of how the treatment helps get rid of trauma-related memory. Some problems with EMDR is that since it's such a new treatment, it still suffers from a substantial variance in findings from study to study, which may account for its lack of superiority to other standard treatments. EMDR for PTSD also has some drawbacks. During the course of EMDR, a person re-experiences the traumatic event that triggered the PTSD. This can be a stressful and emotionally charged process, although a therapist is present to help a person manage these emotions. The traumatic feelings may persist after a session is finished and interfere in other aspects of a person's life. Thanks for watching, guys.